I'm a gynecologist certified in obstetrics and gynecology and reproductive endocrinology and infertility. I diagnose and treat patients struggling with issues related to infertility. A typical day in my office starts in the morning when our patients that are going through fertility treatments come in for blood work or ultrasounds. I see patients for new consultations and follow-up visits. Other days, I might be operating, whether that's doing in vitro fertilization procedures or hysteroscopic or laparoscopic surgery. Endometriosis is a disorder in which tissue similar to the tissues that form the lining of your uterus grows outside your uterine cavity. The hormonal changes of your menstrual cycle affect the misplaced endometrial tissue, causing the area to become inflamed and painful. Endometriosis can be found in up to 50% of infertile women. Patients with endometriosis typically suffer from infertility in about 30 to 50% of cases. The main symptoms of the disease are dysmenorrhea, dyspareunia, chronic pelvic pain, and infertility. Treatment for endometriosis usually involves medication or surgery. Depending on how severe your signs and symptoms are and whether you hope to become pregnant determines the type of treatment. Doctors typically recommend trying conservative treatment approaches first, opting for surgery if initial treatment fails. Fertility treatment ranges from stimulating your ovaries to make more eggs to in vitro fertilization. I present a case of a 32-year-old African-American woman without prior pregnancies presented for initial consultation. This was a childless young woman who for most of her adult life had suffered from endometriosis. She now presented with at least stage 3 endometriosis and clear evidence of premature ovarian aging. She was diagnosed via laparoscopy at age 16 with mild endometriosis and was started on OCPs. By age 28, she had undergone 3 additional laparoscopies, all describing increasingly severe endometriosis. The patient and her husband decided to proceed with infertility treatments. For women diagnosed with endometriosis will require in vitro fertilization, which has been shown to have the highest pregnancy rates per cycle of all fertility treatments. There is no way to totally prevent endometriosis. You may be able to lower your chances of getting the condition and to manage your symptoms if you do get it. Your doctor can prescribe hormones that can lower your estrogen levels. These include birth control pills, patches, or vaginal rings with low doses of estrogen. Hormone therapy can also help with pain, but the effects will only last as long as you're taking the hormones. If the pain is severe and does not likely go away after treatment, a hysterectomy may be the last resort option. Endometriosis is likely to lead to future pain if your ovaries are removed at the time of hysterectomy. Either way, the goal of the surgical treatment is to remove as much possible of the endometriosis that is found outside the uterus. There are major gaps in research on the underlying biology of the condition that will help us predict occurrence, explore preventive interventions, or enable new therapies. More education is necessary to help women and providers identify symptoms of endometriosis earlier and look for physical clues through a pelvic exam, ultrasound, MRI, or laparoscopy.